Hello everyone, I am Mohammed Hamama, and welcome to your ASCP preparation camp. In this camp, we will cover all the topics on the ASCP lecture list. In this video, we will explore the abundant components of the circulating proteome. But before we start, make sure to subscribe to our channel, activate the notifications, and hit the like button for this video. Let's dive in. Unveiling the abundant players in blood plasma. Pre-albumin, also known as transthyretin, is a key player in the blood with a vital role in transporting various molecules. While it migrates slightly faster than albumin during protein electrophoresis, a technique for separating proteins, its functions are just as important. Transport powerhouse, this 3,5-keta protein can bind and carry a small portion of the thyroid hormones, T3 and T4, vitamin A, bound to retinol-binding protein, and the amino acid tryptophan. This transport function ensures these essential molecules reach their target destinations in the body. Nutritional status indicator, due to its short lifespan, about 2 days, and specific amino acid composition, pre-albumin levels can reflect dietary protein intake. Low levels might suggest inadequate protein nutrition. Disease marker, measuring pre-albumin levels can also be a valuable tool in disease diagnosis and monitoring. Decreased pre-albumin can indicate liver damage, inflammation, tissue death, protein loss in the intestines, or kidney disease. Conversely, increased pre-albumin might be associated with steroid use, alcoholism, or chronic kidney failure. Technical considerations. Pre-albumin's lower abundance compared to albumin means it's usually not directly observed in routine blood tests. However, specific laboratory techniques can measure pre-albumin levels if needed. These techniques often involve highly sensitive methods like immunonephrolometry or immunoturbidimetry. Albumin, the all-star plasma protein. Taking the top spot as the most abundant plasma protein is albumin, a champion produced by the liver at a staggering rate of 9 to 12 grams per day. Albumin is present not only in the bloodstream, intravascular space, but also surrounding tissues, extravascular space, with the extravascular pool actually exceeding the intravascular one by 30%. This continuous leakage from the bloodstream necessitates ongoing production by the liver to maintain proper levels. Albumin's diverse functions. Maintaining fluid balance, albumin plays a critical role in maintaining proper fluid balance between the blood vessels, intravascular, and surrounding tissues, interstitial. It achieves this by exerting colloid osmotic pressure, COP. Think of COP as a force drawing fluid back into the bloodstream, preventing fluid buildup in tissues that could lead to edema, swelling. Albumin is responsible for nearly 80% of plasma COP, highlighting its importance. Molecular delivery service, albumin acts as a versatile transport protein, binding and carrying a wide range of molecules throughout the body. This includes fatty acids, hormones, particularly fat-soluble ones, bilirubin, a waste product from red blood cell breakdown, metal ions like calcium and magnesium, and even various drugs. This binding capacity ensures the safe and efficient delivery of these essential molecules to their target sites. pH buffering, albumin contributes to maintaining a stable blood pH, acidity/alkalinity, due to its high content of charged amino acids. These amino acids can act as a buffer, helping to neutralize excess acid or base in the bloodstream. Negative acute phase reactant, during inflammation, the body produces other proteins in response. Interestingly, albumin levels decrease during this acute phase response, making it a negative acute phase reactant. Measuring and interpreting albumin levels. Several methods, primarily dye-binding assays, are used to measure serum albumin levels. These assays exploit the preferential binding of certain dyes, like bromcrysol green or purple, to albumin. Albumin levels can provide valuable clinical insights. Decreased albumin, low albumin levels can suggest various health conditions, including malnutrition, liver disease, protein loss in the intestines or kidneys, or even burns. Increased albumin, while less common, elevated albumin levels might be associated with dehydration or receiving excessive albumin administration for medical reasons. The globulins, a team of specialized proteins. The globulins, blood plasma specialist squad. Imagine a team of highly trained specialists working within your blood. The globulins are just like that. This diverse group of proteins can be further classified into alpha, beta, and gamma globulins, each with unique functions. Alpha-1 antitrypsin, the lung protector. Alpha-1 antitrypsin, produced by the liver, is a crucial member of the alpha-1 globulin team. It acts as an acute phase reactant, meaning its production increases during inflammation. Alpha-1 antitrypsin plays a vital role in protecting lung tissue. Taming the destructive enzyme, during inflammation, white blood cells release neutrophil elastase, an enzyme that helps fight infection. However, this enzyme can also damage healthy lung tissue if left unchecked. Alpha-1 antitrypsin acts as a specific inhibitor of neutrophil elastase, effectively neutralizing it and preventing lung injury. When things go wrong, alpha-1 antitrypsin deficiency. Sometimes, mutations in the gene, SERPINA1, responsible for alpha-1 antitrypsin production can lead to problems. Insufficient production, alpha-1 antitrypsin deficiency results in insufficient protein production, leaving the lungs vulnerable to damage from neutrophil elastase. This can lead to the development of emphysema, a lung disease characterized by destruction of air sacs. Protein dysfunction, even if alpha-1 antitrypsin is produced, mutations can render it dysfunctional. This means it can't effectively inhibit neutrophil elastase, still leading to lung injury. Liver involvement. In some cases, the abnormal protein can accumulate in the liver, potentially causing cirrhosis, scarring, over time. Diagnosing alpha-1 antitrypsin deficiency. Doctors can check for alpha-1 antitrypsin deficiency through several methods. Blood tests, looking for the absence of the alpha-1 globulin band on a protein electrophoresis test. Quantitative tests, confirming low levels using specialized methods that measure the amount of protein present. Genetic testing, identifying the specific gene mutation responsible for the deficiency. Treatment and management. If you have alpha-1 antitrypsin deficiency, there are steps you can take to manage the condition. Smoking cessation, this is crucial to prevent further lung damage caused by smoking. Protein replacement therapy, receiving purified alpha-1 antitrypsin protein intravenously can supplement the deficiency and help protect the lungs. Normal alpha-1 antitrypsin levels typically range from 70 to 200 mg per deciliter. Alpha-fetoprotein, a fetal mystery. Alpha-fetoprotein, AFP, is another member of the alpha-1 globulin team, but its role in adults remains somewhat enigmatic. Synthesized in the developing fetus by the liver, AFP levels naturally decline after birth, reaching adult concentrations within the first year of life. The exact function of AFP in adult humans is still being explored. Some hypotheses suggest that AFP might shield the fetus, protect the developing fetus from the mother's immune system during pregnancy. Bind to estrogen, interact with the hormone estradiol, although the specific implications of this binding are unclear. AFP in pregnancy and cancer screening. Maternal AFP levels are measured during pregnancy, typically between 15 and 20 weeks gestation. Increased levels can be indicative of potential fetal abnormalities, such as neural tube defects, spina bifida, abdominal wall defects, anencephaly, absence of major portions of the brain, chromosomal abnormalities, Down syndrome, trisomy 18. Twin pregnancies, elevated AFP levels are common. It's important to note that several factors, such as maternal weight, race, and diabetic status, can influence AFP levels. In adults, AFP can be used as a tumor marker, particularly for liver cancer screening. A specific AFP fraction, designated AFP-L3, shows promise in identifying patients at an increased risk of developing hepatocellular carcinoma, the most common type of liver cancer. Alpha-1 acid glycoprotein, AAG, a multitasking mystery molecule. Alpha-1 acid glycoprotein, AAG, also known as orosomucoid, is a multifunctional plasma glycoprotein synthesized by the liver. This protein seems to wear many hats, and scientists are still unraveling its full range of functions. A potential player in the acute phase response, AAG concentrations demonstrably increase during states of stress, trauma, infection, and pregnancy. This elevation suggests a role in the body's well-orchestrated response to tissue injury or inflammation, known as the acute phase response. AAG's ability to bind to a wide range of inflammatory mediators might be key to this function. Immune system modulator, the structural similarities between AAG and immunoglobulins, antibodies, raise intriguing possibilities. AAG might play a role in regulating the immune system, but more research is needed to fully understand this potential function. Drug transport and metabolism, AAG's ability to bind to various medications can influence how they behave in the body. This can impact factors such as how the medication is distributed throughout the body and how long it lasts before being eliminated. Ceruloplasmin, the copper chauffeur. Ceruloplasmin, CP, an alpha-2 globulin, is the primary carrier of copper in the bloodstream, accounting for approximately 95% of its total concentration. Think of ceruloplasmin as the chauffeur responsible for transporting copper throughout the body. Positive acute phase reactant, like AAG, ceruloplasmin levels increase during inflammation, severe infection, tissue damage, and some cancers. Estrogen levels can also influence ceruloplasmin levels, causing them to rise. Ceruloplasmin possesses a characteristic blue color in solution. In rare instances, very high levels can impart a greenish hue to blood plasma. Production and elimination. The liver is the principal site of ceruloplasmin synthesis, although macrophages and lymphocytes also contribute small amounts. Under normal circumstances, ceruloplasmin has a half-life of approximately 4 to 5 days, meaning it's constantly being produced and broken down in the body. A diagnostic tool, Wilson disease is a genetic disorder characterized by mutations in the ATP7B gene. This mutation results in diminished ceruloplasmin levels in the blood, serving as a valuable diagnostic indicator for the disease. Unveiling more globulins and their vital roles. Haptoglobin, the hemoglobin hero. Haptoglobin, HP, is a critical player in the alpha-2 globulin team, with a fundamental role in managing hemoglobin, the iron-rich protein responsible for oxygen transport in red blood cells. Made in the liver, haptoglobin is an alpha-2 globulin protein synthesized by the liver. Acute phase reactant, like some other globulins, haptoglobin levels can increase during inflammation, burns, ulcerative colitis, heart attack, and severe infection. Hemoglobin scavenger, when red blood cells break down, lysis, they release hemoglobin into the bloodstream. Haptoglobin acts as a specific scavenger molecule, efficiently binding to this free hemoglobin. This prevents the free hemoglobin from causing damage in the body. Clearance by the RES. The HP hemoglobin complex is then targeted for rapid clearance by the reticuloendothelial system, RES, a network of cells in the spleen, liver, and bone marrow that removes debris from the bloodstream. Protecting the kidneys, haptoglobin acts as a filtration mechanism, preventing excessive amounts of free hemoglobin from reaching the kidneys. Free hemoglobin can damage the kidneys, so this is an important function. Indicator of hemolysis. In cases of accelerated intravascular hemolysis, excessive red blood cell breakdown within blood vessels, HP levels demonstrably decline. This is because HP is being consumed as it binds to the liberated hemoglobin. Measuring HP concentration can therefore be a valuable tool for clinicians to diagnose hemolysis and identify potential underlying conditions. Cooperative effort. Haptoglobin functions cooperatively with other plasma proteins, such as Hemopexin, to ensure the efficient elimination of free hemoglobin. The importance of haptoglobin: when HP is depleted due to overwhelming hemolysis, it can lead to an upsurge in free hemoglobin, potentially triggering downstream complications. Alpha-2 macroglobulin, the protease inhibitor. Alpha-2 macroglobulin, alpha-2M, is another key member of the alpha-2 globulin family. This high molecular weight protein, synthesized by the liver, is a prominent component of the alpha-2 globulin fraction seen on protein electrophoresis. Protease bodyguard: alpha-2M functions as a broad-spectrum protease inhibitor. Proteases are enzymes that break down proteins, and alpha-2M acts as a bodyguard, safeguarding tissues from excessive proteolytic activity. This helps to maintain a healthy balance of protein breakdown and protein synthesis in the body. Elevated alpha-2M levels. Several conditions can lead to elevated serum alpha-2M levels. Nephrosis, kidney disease. In some cases of kidney disease, the kidneys may not be able to efficiently clear alpha-2M from the bloodstream. Diabetes mellitus and hepatic dysfunction. These conditions can also influence alpha-2M levels. Pregnancy and hormonal contraceptives. Pregnancy and the use of hormonal contraceptives can cause a rise in alpha-2M levels. Measuring alpha-2M. Several analytical methods are available for the quantification of alpha-2M, including radial immunodiffusion and enzyme-linked immunosorbent assay, ELISA. These techniques allow researchers and clinicians to measure alpha-2M levels and assess their potential role in health and disease. Transferrin, the iron chauffeur. Transferrin is a key player in iron metabolism, acting as the primary transporter of iron throughout the body. Iron transport specialist, equipped with 2 high-affinity binding sites, transferrin can simultaneously transport 2 ferric iron ions, Fe3+. This ensures efficient iron delivery to cells that need it. Structure and synthesis. Single chain, short life. Transferrin is a single polypeptide chain synthesized by the liver. It has a circulating half-life of approximately 8 to 10 days, meaning it's constantly being produced and broken down. Negative acute phase reactant: unlike some other proteins, transferrin levels decrease during inflammation. This is why it's classified as a negative acute phase reactant. Iron delivery and release. Not always fully loaded, under normal conditions, only about 20 to 50% of transferrin's binding sites are occupied with iron. This leaves room for efficient iron uptake as needed. pH-dependent affinity: transferrin exhibits a clever trick with iron. At the body's normal pH, iron remains tightly bound to transferrin. However, when transferrin reaches iron recipient cells, there's a drop in pH within cellular compartments. This change in acidity weakens the bond between transferrin and iron, promoting iron release for cellular uptake. The cycle continues: following iron delivery, the transferrin without iron, apotransferrin, returns to circulation, ready to pick up more iron and complete the transport cycle. Assessing transferrin levels. While directly measuring transferrin concentration isn't routine, the total iron binding capacity, TIBC, test provides an indirect assessment. This test reflects the total amount of iron transferrin can potentially carry. Transferrin in cerebrospinal fluid. A distinct form of transferrin, called tau transferrin or beta-2 transferrin, is present in the cerebrospinal fluid, CSF, but absent from serum. The detection of tau transferrin in serum or other body fluids can indicate the presence of a CSF leak. Transferrin levels and clinical significance. Measuring serum transferrin concentration is a valuable tool for diagnosing and evaluating various conditions. Low transferrin, suggestive of iron deficiency anemia, malnutrition, liver dysfunction, or protein-losing enteropathies. High transferrin, iron deficiency. This might seem paradoxical, but in iron deficiency states, the body attempts to compensate by upregulating transferrin production. So, transferrin levels can be high despite iron stores being depleted. Increased transferrin saturation, this indicates iron overload disorders such as hemochromatosis. Absent transferrin, atransferrinemia, a rare genetic condition characterized by anemia and iron deposition in organs. Beta-2 microglobulin, a tiny protein with big roles. Beta-2 microglobulin, beta-2M, is a compact protein with a crucial role in the immune system. Structure and function: beta-2M is a small protein, 99 amino acids, produced by B lymphocytes, a type of white blood cell, and some tumor cells. It lacks sugars, non-glycosylated. Clearance and clinical significance: due to its small size, beta-2M is efficiently filtered by the kidneys, leading to a short lifespan in the bloodstream, around 100 minutes. Elevated beta-2M levels can indicate several conditions. Kidney problems: when the kidneys are compromised, beta-2M clearance is impaired, causing a rise in blood levels. Inflammation and cancers: inflammatory states and certain cancers, especially those involving B lymphocytes, can also lead to increased beta-2M production and higher blood concentrations. In chronic lymphocytic leukemia, a B-cell cancer, high beta-2M predicts a poorer prognosis. Multiple myeloma: blood beta-2M measurement is used as a staging tool for multiple myeloma, another B-cell cancer. Immune activation: increased beta-2M levels might also reflect heightened immune system activity and have been used as a marker for transplant rejection. Detection methods: beta-2M concentrations are typically too low to be directly visible on routine blood tests. Specialized immunoassays are used for accurate measurement. Hemopexin, the hemoglobin hero. Hemopexin is a vital protein that plays a critical role in mopping up free heme, a potentially harmful molecule released during red blood cell breakdown. Heme magnet: hemopexin acts like a magnet, binding to free heme with the strongest affinity of any known protein. This prevents the free heme from causing damage. Taming free radicals: unbound heme can generate harmful free radicals, which can damage tissues. Hemopexin efficiently captures free heme, preventing this oxidative stress. Heme delivery and iron recycling: the heme-hemopexin complex is transported to the liver, where the heme is dismantled. The precious iron component is then recycled for the production of new red blood cells. This ensures efficient iron utilization in the body. Beyond red blood cells, hemopexin can also bind to free heme released from other sources like myoglobin, a muscle protein, and catalase, an antioxidant enzyme. Hemopexin levels and clinical significance. Increased levels: inflammation, diabetes, muscular dystrophy, and certain cancers, melanomas, can lead to elevated hemopexin levels. Decreased levels: low hemopexin is a telltale sign of hemolytic anemia, a condition where red blood cells are destroyed at an abnormally high rate. Detection methods: radial immunodiffusion is a common method for measuring hemopexin levels in the blood. Don't keep all this valuable information to yourself, share it with your friends who might find it interesting and beneficial. And if you have any questions or comments, feel free to leave them down below. We love hearing from our viewers and we will do our best to answer all your questions. And finally, don't forget to ask for our ASCP short notes to supplement your studying. These notes are a great resource to help you review and retain the information we cover in our videos.